Hello everyone, welcome to Logic Medico. Today's interesting topic is movements of the thumb, which is most confusing to the students. So this thumb, as you can see, it's not exactly in the plane of the palm. It is actually perpendicular to the plane of the palm. See, the thumb is medially rotated for 90 degrees. If you place your palm flat on the table, you'll know that. So the thumb is medially rotated for 90 degree. Okay, so that is the first knowledge we should have to understand the movement of the thumb. This movement of the fingers is flexion and extension. So in the plane where flexion and extension is happening, that in the same plane, this is abduction of the thumb and adduction of the thumb. So movement of the thumb away from the plane of the palm is called abduction, ABD. Movement towards the plane of the palm, coming back into the plane of the palm, adding to the plane of the palm, adduction. So this movement is called adduction of the thumb. So I hope abduction and adduction is clear. The next movement of the thumb are flexion and extension. To understand that, see this movement of the fingers. This movement of the fingers away from the midline, that is the middle of the middle finger, is abduction. But this movement of the thumb is extension. The movement in the plane of the palm is extension. Across the plane of the palm, like this, is flexion of the thumb. So this is extension in the plane of the palm, extension, and towards the plane of the palm and bending is called as flexion. Extension is straightening, you can see that. Flexion is bending. So this is the other set of movement of the thumb. The next unique movement of the thumb, because of which we are able to do most of our jobs most comfortably, is called as apposition. The pulp of the thumb, this area, the tip of the thumb, the pulp of the thumb touches the pulp of the other digits, other fingers. See? It's opposing, right? The pulp of the thumb is opposing the pulp of the other digits. It's called as apposition. Okay, this is a unique movement. Because of this, we are able to grip upon a pen, pencil, anything. We are able to grasp, use the hand for a grasping purpose. So this unique movement of the thumb is called as apposition, where the pulp of the thumb opposes the pulp of the other digits. To summarize the movements of the thumb, abduction is the movement of the thumb perpendicular to the plane of the palm. Going towards the plane of the palm is called adduction of the thumb. The movement extension and flexion takes place in the plane of the palm. Okay, in the plane of the palm. If it becomes straight, it is extension, and if it bends across the plane of the palm, it's flexion. So abduction, adduction, extension, flexion. By definition, abduction is a movement of the thumb forwards away from the plane of the palm. Going backwards towards the anatomical position is adduction, or adding the thumb towards the hand is called adduction. Extension and flexion are the movement taking place in the plane of the palm itself. Extension is straightening and flexion is bending. Whereas apposition is a movement of the thumb in such a way it touches the pulp of the other digits, like this. It's called apposition. To summarize the muscles causing this in detail, abduction is caused by abductor pollicis brevis. Is there in the thumb, ball of the thumb itself. Abductor pollicis brevis and abductor pollicis longus. It's an extensor compartment muscle. Next, adduction. Adduction is caused by adductor pollicis. It is a hand muscle, deep muscle of the hand, adductor pollicis. And first interosseous, palm or interosseous is a adductor. Next, flexion is caused by flexor pollicis brevis, which is there in the ball of the thumb, and flexor pollicis longus, which is their forearm muscle. So two flexors are there, one to flex the proximal phalanx, the other to flex the distal phalanx. Flexor pollicis brevis and longus. Okay. Next is extension. Extension is caused by two muscles, extensor pollicis longus and brevis. See, one to extend the distal phalanx, the other to extend the proximal phalanx. This is a distal phalanx. Next one is the proximal phalanx. The further away is the distal, this one, where the nail is there, no, that one. The one which is closer is the proximal. So extensor pollicis longus and brevis, both are posterior compartment of forearm muscles. Last but not the least, opposition is caused by opponens pollicis. Again, it's a thenar muscle. Opponens pollicis causes opposition movement. The pulp of the thumb touches the pulp of the other digits. Okay, so thumb thenar eminence muscle is mainly supplied by median nerve. The flexor pollicis longus is also supplied by anterior interosseous nerve, which is the forearm muscle. Whereas the extensor muscle, extensor pollicis longus, brevis and abductor pollicis, these three are supplied by posterior interosseous nerve, branch of radial nerve. So these movements are taking place, the thumb movement, this movement is taking place in first carpo-metacarpal joint between the trapezium and the base of the first metacarpal. Okay. This movement, abduction, adduction, flexion, extension, this movement, opposition. These movements are taking place in the first carpo-metacarpal joint of the thumb. Thank you for watching and learning from Logic Medico the unique movements of the thumb, which are abduction, adduction, flexion, extension, opposition. Thank you once again for watching and learning from Logic Medico. Have a good day. If you are new to our channel, kindly consider subscribing to our channel. Don't forget to press the bell icon. Share with your friends too. Thank you.